Tibial plateau fractures affect nearly 70,000 patients a year, accounting for 1% of all fractures. High-velocity impacts like car crashes and blunt force trauma cause stiff bone fragments of the tibia to depress downward into the spongy soft part of the bone. To ensure proper healing and function of the knee, these depressed fragments need to be adjusted back into plane to form the tibial plateau itself. Adjustment of these fragments is done intraoperatively and is often a complex surgical procedure, with inexperienced surgeons struggling to achieve adequate adjustment. Adjustment, also known as reduction, requires manipulation of the bone fragments in multiple directions. Most often, fragments need to be adjusted medially towards the midline of the body and laterally away from the midline of the body. Surgeons lack a tool that can move the fragments in both directions. Welcome the Osteorise Pro, a novel medical device that utilizes a dual action mechanism, allowing the user to lift and tilt independently. The lifting mechanism is controlled by a scissor jack with a threaded screw component that increases and decreases height, a novel approach for lateral and medial lift. The tilting mechanism is operated by the surgeon with indentations to attach a lamina spreader, making Osteorise Pro compatible with surgical tools already in use. Currently, surgeons use a variety of methods and tools to restore the original shape of the plateau. An osteotome is typically used to create separation between compressed bone fragments, and a lamina spreader is used to elevate them to the correct position. However, this technique leads to complications. Lamina spreaders can lead to further fractures in the bone as they apply a small point force. In addition, there is limited control in elevation, as fracture angle varies per case. The surgeon will make multiple attempts at restoring the bone fragments to the correct position, resulting in lengthy procedures and varied results. With the Osteorise Pro, these problems are a thing of the past. The device is first inserted into the operating site using the wedge feature attached on the front. Once the device is inside, K-wires are put through the anchoring holes to secure it before elevating. Next, the surgeon can utilize the lifting and tilting mechanisms to manipulate the fragments. The fragments will then be temporarily stabilized with the K-wire before a buttress plate is used to lock everything in place. By providing a uniform process for surgically treating depressed fractures, surgeons will be able to train new or inexperienced physicians better, resulting in less deviations in patient outcomes. A large majority of depressed tibial plateau fractures, an estimated 77%, require surgical intervention. Each surgical case for the treatment of these fractures varies greatly, as repair is based on individual physician preferences and training. These variations in surgical technique lead to deviations in patient recovery, as well as operating time and equipment used. With over 50,000 patients undergoing surgical treatment on the tibial plateau annually, there is a demand for novel surgical devices like the Osteorise Pro. The average cost for surgical intervention of these fractures is anywhere between $1,800 and $5,000, and the target market is valued at between $97 million and $265 million in the United States alone. The U.S. orthopedic devices market is expected to grow by 3.9% annually through 2031. Osteorise Pro can provide novelty to this market, as our device is adaptable to many different patient anatomies and fracture mechanisms. With Uplift Orthopedics and the Osteorise Pro, we all can simply excel.